Achilles tendonitis. Achilles tendonitis can occur in one of three places. The uppermost portion of the tendon where it originates from the gastrocnemius and soleus muscles. The mid portion of the tendon between the muscle and the heel bone. The attachment of the tendon into the back of the heel. Causes of Achilles tendonitis. The most common causes of Achilles tendonitis are poor training techniques, particularly by older athletes. For runners, the type of surface used for running can have a negative impact on the Achilles tendon. Poor athletic shoe selection can also create Achilles tendonitis. Foot structure will also play a role in the development of Achilles tendonitis. Tight Achilles tendon is probably the biggest cause for pain in the tendon. Symptoms of Achilles tendonitis. The main complaint by patients is pain in the back of the heel. This pain needs to be distinguished from retrocalcaneal bursitis, or retrocalcaneal bone spur, along with some less common causes such as gout or rheumatoid arthritis. The pain is most pronounced when initially walking, after periods of inactivity such as sleeping or sitting for a long period. Walking around will generally decrease but not eliminate the amount of pain. When exercising, the pain is most prevalent when jumping or pushing off. Actually pressing on the Achilles tendon may also elicit pain, and you may be able to feel swelling along the course of the tendon. Diagnosis of Achilles tendonitis. Most cases of Achilles tendonitis is diagnosed by proper history and physical examination. Squeezing the tendon may yield pain. Bending the foot upwards with the knee in a locked position will usually also cause pain. When the pain on the Achilles tendon is at the level where it attaches into the heel bone, an X-ray may be helpful to rule out other problems such as bone spurring on the heel bone and slash or calcification of the tendon itself. In situations where the tendon does not respond to treatment or a tear is suspected, an MRI can be very helpful in evaluating for minor and major tears within the tendon, along with other problems such as calcification of the tendon. Treatment of Achilles tendonitis. In determining treatment for Achilles tendonitis, it is important to first determine the cause. Elimination of factors that are exacerbating the problem such as poor athletic shoes, lack of adequate warm-up or poor running surfaces all need to be addressed. In order to reduce the complications associated with this condition, conservative treatment should be instituted immediately. Icing the area will help reduce the inflammation and pain. In mild cases where you are still participating in athletics, I would advise ice both before and after exercise. Stretching of the Achilles tendon is also mandatory. However, it should be pointed out that for most people, stretching will relax the tendon slightly but does not actually stretch it. Short-term use of anti-inflammatory medication is also helpful. This type of medication is indicated for acute tendon problems and should be limited in chronic forms of tendinopathy, because in chronic tendon problems there is no longer inflammatory cells within the tendon and therefore anti-inflammatory medication will be of limited value. If these simple measures do not seem to be helping, then cessation of the athletic activities is also mandatory. Remember, our goal here is to minimize damage and not let the condition worsen. Immobilization of the foot is another means to reduce Achilles pain and aid the tendon in healing. This is accomplished through the use of a night splint. This keeps the Achilles tendon in its proper position while sleeping. In more severe cases, a cam walker, or walking cast may be necessary to keep the tendon immobilized all day as well. The less the tendon is forced to stretch and overwork, the quicker it will heal. In situations where these simple procedures have not helped, then physical therapy may be necessary. We generally do not give cortisone injections for Achilles tendonitis, particularly at the insertion of the heel, because this has been shown to increase the chance of Achilles tendon rupture. If injectable cortisone is to be used, it should be injected underneath the skin and not directly into the tendon. Read the full article at www.foot-pain-explained.com/achilles_tendonitis.html.